And we are back live. We're so sorry we lost the connection here. We lost our wireless signal, but we are back. Welcome back, mamas. We are here chatting with Lauren Bender. She's telling us her beautiful story of Mighty Madeline. We interviewed her a few months back, and we have that posted on our blog. So you can go to our blog and you can view that story as well. And just an amazing story. She was going back through, and we'll have the 2 videos there on Facebook. We're so sorry that it dropped, but she was going through and she was telling us just the amazing story of the doctors not giving her any hope at all with her pregnancy, bleeding throughout her pregnancy, but she held straight to her faith, held and anchored to her faith, and as long as there was a heartbeat, which there was every time a heartbeat, you were going to continue this pregnancy, and you were going to continue to carry your miracle baby. And you were in the middle of telling us, I know that you switched over to the high-risk doctor. You were on bed rest. So after that, after you were on bed rest, when did labor start? I know that you said it was around 26 weeks. At this point, your water was broken.
Yeah, so my water broke at 16 weeks. I was at home on bed rest for 10 weeks. And then I got admitted into the hospital for hospital bed rest at 26 weeks. They gave you steroids right away, typical premature process there. And the steroids actually put me into labor. I look kind of oddly enough. They shot my white blood count up too, and it was like we were teetering on the scale of I don't think I have an infection. I think it's the steroids. Long story short, I was on MAG for about 15 hours that first time. Stopped labor. Things went quiet for a good. I think I was in the hospital for a good 10 days. Maybe it was almost 2 weeks. And then I started bleeding more and heavier. So long story short, I never really went into labor when I had Madeline, but we decided, we were kind of evaluating, should we do a C-section now when both myself and Madeline were healthy and well, or do we wait to get every single day out of this pregnancy? And it's risky doing that because of a number of different reasons. And so we did decide, we were weighing all of our options, and we did decide to go ahead with the C-section at 28 weeks and 3 days because I did start bleeding much heavier. Turns out we suspected it was very acute placental abruption. So I think we did make the right call to go in and go ahead and have a C-section at that time.
Yeah. So then they whisked her straight away to the NICU. Did you get any time with her at all right there, or any skin to skin? Anything at all?
No, in the surgery room, you're laying there getting your C-section, and they had gotten Madeline. I heard the very tiniest whimper, which I knew was great sign. So without the amniotic fluid, her chances of not having much to little lung tissue was high, and if she was going to be able to breathe at all with any support. So hearing the tiniest whimper was a huge amount of great hope. And I could kind of look over to the left and see the whole neonatologist and the NICU team over there working on her. And Dr. Dreyer, the neonatologist, looked at me kind of across the room and said, she's doing really well. And she only needed 30% oxygen at that time.
Okay.
So I felt just so thankful and just relieved. And they take me to the recovery room. And it's probably an hour after she was born at this point, and Dr. Dreyer comes back into the room. Well, let me back up. They immediately start telling you to start hand pumping or hand, to start work. The baby's going to need all your colostrum, every single drop, and they're showing you how to do it with the syringe, and so they're starting to do that. I'm like, okay, this is great. We're going to do it. And within that hour, Dr. Dreyer came down and told us that Madeline was not doing well, and she's on max support, and if she needs any additional help, that they would not be able to give it to her. And so he didn't know what was going to happen within the next couple hours, and he was kind of warning me. He's like, I think I gave you kind of a little bit of false hope, of what initially she needed. So that was pretty scary. And I remember thinking, like, what do I do? Do I start pumping? I was just like, I just want to go see her. And because they felt like she may not make it, they did they rolled me down on the bed, down to the NICU, probably sooner than they normally would have, because they thought the chances of her passing were pretty high. So they rolled me down there a couple hours after she was born to see her. I, of course, could not touch her or, hold her or anything, but I did get to see her at that point.
Yeah. And then you had a long journey ahead of you in the NICU. How long was she in the NICU?
She was in the NICU for 123 days. So it was 1 day shy of her turning 4 months. And it was a roller coaster. As you guys all know, she did make it through the night. We just prayed for her, and she did wean on the amount of support she needed throughout that evening. And honestly, her NICU stay was really hard. But she just made very slow and steady progress. Mm-hmm. We did not have huge setbacks, whereas I feel like NICU moms would tell you to expect that. And we had plateaus where she didn't necessarily progress, but we luckily and fortunately did not have any huge setbacks but she, of course, her main issue in the NICU was respiratory. So she was intubated and on a ventilator for a month. The first month she was ventilated. At that point, even when they wanted to extubate her, I think the doctor, which Dr. Hall was so great, she was always willing to give Madeline a challenge, which I really appreciated. And she, I think, was fully expecting to have to re-intubate her with a larger tube, and because she kind of had outgrown hers. And so anyways, they said, well, we'll try her on what we call nasal IMV. So it's like really, they were able to put the cannula in her nose, but a really large version. And it's like still doing the large puffs. And anyways, I think she was fully expecting to have to re-intubate her. And it was a little rough for Madeline to get off of the ventilator, but she always did better kangarooing. It's when you're skin to skin, and her heart beat was really elevated as she was trying to take in this new breathing method. She had to do more work. She kind of had to breathe in some of the air into her lungs, whereas before it was going directly to her lungs with the tube. And so long story short, I think I held her for like 3 days straight. And we got over the hump, and she never had to be intubated again.
Oh my goodness.
It was just felt like it's such a huge success, and that she was able to move forward. She did stay on nasal IMV. I think it was 5 weeks, which is a really long time. Pressure, we just slowly were able to wean her down on pressures and frequency and stuff. So, she just had to go through her breathing or her respiratory steps. So I think after that, you go to CPAP mode, and then you end up going down to high flow and then low flow. So low flow is the only time that they'll let you even attempt oral feeding. So at that whole time, so it was pretty much 3 months of being fed by an NG tube.
So 3 months she was being fed your breast milk. You were pumping.
Yeah.
And she was being fed your breast milk through the G tube, through the NG.
Yeah, I should say too, the hospital is really great. Even that first night, I wasn't quite sure what was going to happen with Madeline, but the nurses there, they are fully support you. They wake you up to pump. They give you everything you need. They're right there to coach you if you need it. This being my second one, I was a little, even my husband, we kind of jumped right back into the swing of things. And he was all hands on with getting the syringe and stuff too, to get every last drop for her. So my milk did come in within 48 hours, where she could get a full feeding, I should say, a full feeding by 48 hours, which was great. And so she was fully fed by the NG tube for 12 weeks. She was fully fed by the NG tube really by 4 months, but that last month we were practicing with the bottle and breastfeeding and NG tube. She had a combination of things.
There was something really special when I was reading back your story earlier today. So I know the first time that they tried to bottle feed her, she was kind of like choking and gagging, and she was having a difficult time with the bottle. And then you brought her to the breast, and she did amazing the very first time that she nursed for 4 minutes straight. This little tiny baby, and she was just.
I make me want to cry thinking about it.
Yes.
She was just so leading up to this, there's like so many fears. You just there's priorities. You're like, my baby needs to breathe. That's the most important thing. Okay, then we're doing better at breathing. Then you're thinking about eating. Okay, how's she going to eat? Is she going to be a tube-fed baby? Is she, there's all these things. And I would just pray and pray and pray. I loved breastfeeding my first, that I'd be able to breastfeed this baby. And pretty early on, doctors were kind of setting the expectations for me, because I would say things like, the longer you wait, the harder it is. I mean, I forget what it is, because we weren't in that scenario, but with preemies that are born, I want to say it's at like 35 weeks, they start oral feeding. And she was well past that point. So they didn't have huge expectations that would be super great for her. So long story short, the day she was able to start oral feeding, we gave her a bottle, and she choked right away. It was scary. And, there's a little bit of different methodology doing it. You lay the baby on the side vertically, just as if they were nursing, and you give them the bottle, as opposed to holding them like this. You kind of hold them long ways on their side. And so they're kind of coaching me through that. And anyway, she did not take to it at all. And then as I was like, well, I really want to breastfeed. And there were a couple nurses that knew that about me. And they were like, you need to establish breastfeeding before we get this bottle back out. So everyone knew my plan. They had an LC come the very next day, and she latched immediately and took right to it and nursed for 4 minutes without getting kind of choked up. And even then it was like, I think I kind of pulled her off during the first letdown, but she was definitely getting the suck, breathe, swallow coordination right away. I was just so proud of her. And even everyone in the room was too. They were just like, think she's the most amazing woman.
She was just created for that very moment, everything that led up, because breastfeeding, it's not just about the nutrition. When you're feeding your baby directly at the breast, it's that bond that all these moms talk about. And and I tell moms, I have 4 kids, I didn't breastfeed all of them, and I tell all my moms, listen, moms are wired to bond with their babies regardless of how our babies are fed, or if we bring them to the breast. But I will tell you that when you're feeding your baby directly at the breast, there is a special connection and there is a special bond during that time. And that's so beautiful that you were able to experience that so early on.
I know.
And that's the scenario.
One thing a neonatologist said to me, Dr. Hall, even the one that I took the tube out, she came in, she's like, well, I'm not surprised that she loves breastfeeding. She's always preferred staying on you and your body as opposed to being in the isolate. Like when I didn't mention this earlier, when she would lay on me, her oxygen need would go down like 30% sometimes. Say she was on sometimes she was as high as 60%. It would go down to like 40 or 30. It was crazy how she didn't need all that extra oxygen when she'd hear your heart rate be on your body for temperature control. And so she's like, I'm not surprised. She's always liked touching you, being on mom more.
Right. Close to you. So then how did breastfeeding and pumping look after that? So you were pretty consistent with bringing her to the breast. You were still keeping up with exclusively pumping. How did it look like at that point?
Yeah. So at that point, so again, I worked from home full time. So I had the great opportunity to work from the NICU full time. Wow. And I have the best support from my leadership at work. And so I had the opportunity to work, and when it was time to feed her, I could. So I would put her to breast 4 times a day, in the evening, come home, and then she was, they would attempt the bottle, and sometimes she took it, sometimes she didn't. And then, and usually always finish the feeding with the NG too. Mm-hmm. So that's how it looked for those 3 to 4 weeks before she was discharged. And honestly, she never took to the bottle. She would get to the point where she would tolerate about 2 a day, where she would take the full feedings. And it was really dependent on the nurse, which was like patient. I think Madeline was always very intuitive on which ones were going to be patient and calm. And and she just always did better that way. And what happened was they saw how, she was getting full feedings during the day. And so I spent the night over like one weekend so she could breastfeed it. And they're like, well, let's see if she has the endurance to breastfeed 8 times a day as opposed to just 4 times. And so we did that and she did great. And so then we got to the point we needed to make sure she could gain weight. So here's the deal. So Madeline has chronic lung disease, and she burns a lot of calories breathing and keeping her stats up. So when she was getting my breast milk, they fortified it to be 24 calorie most of the time. So she was able to, kind of counteract some of those extra calories she was burning to keep up with the weight. So they were like, I don't think she's ready to be exclusively breastfed. Everyone, I think, understood that she had the stamina and could do it, but they didn't feel like she would be able to keep up with her weight. And so we started kind of trialing what was the magic number of bottles that she has to learn to take. And so and let's pack those 2-3 bottles, whatever it's going to be, with calories. So we'll fortify those bottles. And so that's what we ended up doing. And we found out 2 was the magic number. We gave her 1 in the evening, 1 in the morning. And like I said, we would just pack those. We fortify those. We even put olive oil in those bottles too for extra calories. And that's how we ended up discharging. So I stayed a full week before she was discharged. We took the NG tube out, and we couldn't rely on it at all. And and then we just kind of had a week trial, and she continued. She gained 5 ounces that week, so we were able to leave.
That's amazing. We have some comments coming in. Christina was asking, were you ever pressured to give any supplemental feeds besides breast milk? You were talking about that, so you were fortifying your breast milk.
Yeah.
And are you exclusively breastfeeding now? When did that stop, or did you continue?
Yeah, good question. Okay, so yes, I was encouraged to try different things because as we were oral feeding, okay, well, let me back up. So when she was tube fed for the longest time, I'm not going to get some of the language wrong, but it was slow and steady. I forget what they call it, like continuous feed. It was a continuous feed. So it wasn't until we were talking about oral feeding where they transitioned to bolus feeding, which is more like, okay, we're going to give her say 2 ounces over 30 minutes, just like if she was breastfeeding. So as we were doing that, we started discovering she was spitting up more. We were finding out she had some reflex issues. So because of that, that's when the talk of trying different formulas came up. Or when they're doing the bottle, like maybe if she has a bottle, she needs a thicker thing, because breast milk's about the reniest that you can have. So there was definitely a lot of talk around that. Honestly, I wasn't anti formula. I kind of was with my first, but in this situation, things changed. Whatever she needs to get fed and to keep it down and to be able to gain weight was my priority. So, we tried some other things, and actually it didn't help. So we went back to breast milk. And honestly, all the doctors preferred her being on breast milk for a couple reasons. If she did spit up, aspirating is a big thing that they're worried about because we have to protect her lungs. And so if she gets any fluid in her lungs, turn into pneumonia, and any other damage to her lungs is very critical. So the body, does better with breast milk getting into the lungs versus formula. So there was a big, everyone was just kind of like torn on what the best route for Madeline was. But ultimately, she told us that she wanted the breast milk.
You wanted the breast milk.
Yeah. But so long story short, we went home taking 2 bottles a day, and then she really wanted to drop the bottle by the end of November. So that was probably 2 months after discharge. So my pediatrician was like, well, let's try it. Let's give her a week, come back in a week. We'll do a weight check and see if she's, stronger and, not burning as many calories. So her weight gain slowed down after that, but she still has always stayed on her trajectory. So she's been okay. So we've been able to stay exclusively breastfed since November.
Since November. Wow, that's amazing. And are you still pumping? I know you were using a Spectra pump when you were pumping. So you're still using the Spectra pump?
Yeah, from time to time, we've had little episodes of when Madeline just doesn't want to eat a ton, or like what happens is she's had kind of a little bit of a neck thing that made her nauseous, and so I just had to make sure my supply didn't get affected. So I don't pump regularly each day, but just as we have things come up, I would be pumping too with my Spectra. So I actually had a different breast pump with my first, and the second, with this one, I remember after Madeline, I was talking with an LC. And I was like, actually, I'm thinking about trying a different model this one. And they told me right away, they're like, the Spectra is the best way to go for preemie moms because it's most similar to a baby actually feeding. So I got online and ordered it right away.
Oh, that's so good. That's so good. Yeah. So right now you're just exclusively feeding her at the breast.
Yep.
For the most part. And she's
for the most part. I spent 4 months pretty much exclusively pumping, and as all the amazing moms that do that for a full 12 plus months, I mean, God bless you. It is a commitment, and I would have done it and in a heartbeat. And you get to the routine. I would pump on the way to the hospital in the car, pump on my way back. I mean, I was carrying that thing everywhere. I had a pump bag. I actually just got it out the other day, and my 3-year-old was like, "But Mom, where's your pump bag?" Because I didn't have it all packed up in a bag. So she was used to be carrying that thing around everywhere with me for 4 months.
Oh, so you were able to take her home. She was almost 4 months. You said one day before 4 months, you were able to bring her home. And how is she doing now? How's Madeline doing? Getting ready for her big birthday party?
Yeah, she's doing great. Thanks for asking. It's hard, just being discharged is like, to me, it felt like a dream come true. Still hard at home, but I'd rather it be hard at home than hard in the hospital. And my husband was a huge, big support. Those first few weeks were really hard as we adjusted, and her having reflux, without any of the premature respiratory issues is already stressful enough. So there was a lot of just sitting and holding her, so to make sure she would digest her food and keep everything down. And but we got through that, and now she's doing great. She's she's a little delayed in her gross motor skills, but she's doing awesome. She's rolling and she's full of personality. She's so close to sitting up, and we just couldn't be more proud of her. She's going to be 1 at the end of the month. So I already like to throw a big party, let alone with Madeline's situation. I'm just like going way over the top.
I know. I wanted to read some of the comments because there's so many encouraging comments. I'll put them up. Joy says, "I'm so happy for you."
Oh, thank you.
Kayla says, "Amazing. She just needed her mama. Kangaroo care and nursing was a blessing with my little one in the NICU."
Oh, yeah. It makes such a big difference. It really does.
Mary says, "There's nothing stronger than mama's love."
Thank you.
Rosanie says, "This is so amazing." Angela says, "So amazing that she latched so well." I am so amazed with that. That just stood out to me because you don't see that. Baby so young.
Well, with my first, you think about like, oh, they need a latch, right away. You put them on the chest, let them find, all these things I learned and held to such a high regard for my first. I mean, I knew I just had to throw it out the window and just trust Jesus and see what Madeline was going to do. And these babies are so strong and resilient, and they will tell you what they want to do. Just so often she was taking the lead, and I mean, it makes me want to cry. I think all that kangaroo time, if there's any other moms that are in this situation or maybe in that situation in the future and don't even know, it's, kangaroo as much as you can, and get a staff that supports that. I would literally, it'd be 5 hours. I would push my pumping. They would tell me, well, you should sleep longer at nighttime, but I would save that long expanded time for the day when I could, for the daytime. So then I could hold her longer, and then I'd get up more at night and pump. That was me. But I think it made all the difference in her recovery, and it made all the difference to our breastfeeding journey. I really do.
I mean, there's documented evidence with the kangaroo care and the skin to skin. Babies that are doing skin to skin in the NICU go home sooner. on the mama's chest, that's the natural environment for babies. So there
Yeah.
is where their body temperature is regulated, their heart rate is regulated. You talk about her heart rate being a little bit
Yeah.
elevated. It will regulate to mama's heart rate, which is something
Yeah.
that's just amazing. And there's documented evidence of the importance of skin to skin. So
Yeah.
absolutely so important. I tell moms another tip, for moms that are in the NICU, you can also pump when you're doing skin to skin.
Yeah.
So
Yeah.
even having your baby, in between, and either
Hmm.
pumping, one breast at a time, or preferably if you're going to be pumping both, but you can pump while doing skin to skin. And that's
Yeah.
something that you can even do at home too, with a baby if you're exclusively pumping, because there is that bonding too that happens with skin to skin. So if you're not necessarily able to bring the baby to the breast and you're pumping, you can do
Yeah.
skin to skin, and you can pump, and you can still have that time with baby.
Yeah. Absolutely. I mean, I felt my letdown so much when I was holding her. I always had to keep a towel handy because, yeah, your body's just like goes
Yeah.
into the
All of the
natural state of
hormones,
wanting to
all of
feed
the
her.
hormones.
Hmm.
Yeah, all of the hormones. It helps with the letdowns, and it helps with your milk supply. Absolutely.
Yeah.
We have Samantha says, I'm sure your colostrum gave her such strength, such a
Yeah.
superpower.
Thank you. Yeah. You know, the NICU too, what they do with the colostrum at first is, and they do it too with your breast milk, is they put it on a little Q-tip and they rub it
Mm,
around the lips and the mouth. And so
mhm.
that helps with kind of keeping their mouth clean, infection setting in, and it gives the mom something to do. But they want every single little drop of your colostrum to do that for her. So
Liquid
it
gold,
was,
every drop. It's with the
yeah,
oil. I know sometimes they'll even put it like inside of the nose to clean the
yeah,
inside of the nose, and all of the oral care for the babies. They
yeah,
do it with the same colostrum and the breast milk. So that's beautiful. That's so
yeah.
good.
And it's just, it was nice to be in an environment where like all the staff felt that way. It
Mhm.
wasn't like, I felt like with my first, anyone that breastfeeds understands that colostrum is so important.
Yeah.
But it was, I don't know, it was kind of nice for for all the doctors and nurses to just be like really encouraging to get every last drop so that they could give it to the
Exactly.
baby.
That's so encouraging and so important for those preemie babies. I mean, breast milk is important for all babies, but especially for the preemie babies. They have such a
Yeah.
better
And
chance at survival, less risk of getting different infections like neck, which is very typical and common
yeah,
with the babies. Madeline never had any of that.
yeah, nothing. And I, during that time on bed rest, I definitely read the whole gamut, what to be prepared for. That's kind of my
Mhm.
personality. I wanted to at least know the routine or the normal things to expect. And I was just thrilled that, and I contribute a huge part of that to breastfeeding for
Yeah,
sure.
yeah, absolutely. I know we talked a little bit about how important your village was, your support network. I know you had a
Yeah.
lot of support from your family, from your church family. Everybody was supporting you. You had an amazing LC that
Yes.
supported you as well. I just thought we're kind of wrapping it up. We have just a couple of minutes, but was there a piece of advice or something that your LC gave you? So a word of encouragement? Was there a time maybe that you were like, oh, it's just so overwhelmed? Was there something that stood out to you that made you remember her? I know you talked about how amazing she was with you.
Yeah, she was so great. It was probably everything, not necessarily one thing, but she knew I got there early. I would get there at 7:30 every morning. And so I would be her first stop every day. And so she was just really patient with Madeline and I, and just really encouraging. I felt like her just being her consistency helped me. So like she was okay. So I would get Madeline, kind of put her in position, and um, and she would encourage me the whole time. She'd be like, "You're doing amazing. You're such a good mom." Like I'm gonna cry thinking about it, and just like she loved you so much. And just like as she's counting, or, she was listening to make sure she was swallowing, all those things. She was doing her thing, but she
Yeah.
was just such an encouraging coach at
Oh,
that
you
point.
made me cry. That's so special. Just her presence too, I'm sure. That just that aura of her
Yeah.
being there.
Yeah. So she was just such great support in that regard. And then she also, She was a huge advocate for figuring out how Madeline could get home where she's like mostly getting breast milk with having reflux, and also breastfeeding as much as we possibly can. So she was right there talking with the neonatologist and the nurses, figuring out, talking about formula option, just figuring out the best options for us. And so she was a huge advocate. She talked about how in their staff meetings, she was very much telling Madeline and I's story to the rest of the staff and figuring out the breastfeeding, pumping moms, how to get them more support in the NICU and not feel like they're always just going to be forced to a bottle or, switching over to formula to make it easier. So, yeah, she was a huge help. It was everything. Everything she did was just amazing.
Oh, that's so beautiful. It's so beautiful that you had such an amazing support system. And I know all the doctors were so supportive too, and the NICU, the experience there. And that really helped push you through and get you to where you are today. And I just wanted to say congratulations, Lauren. You're an amazing mom.
Oh, thank you. That's sweet.
Your story is just so inspiring to me, of your faith and your hope and just the love that you have for your family and for mighty Madeline. And we're so happy to be able to give you the opportunity to share your story with us today. Thank you so much.
Absolutely. Absolutely. You guys are so sweet. And Madeline gets all the credit. I just followed her lead, trying to be everything that she needed me to be, but she's the amazing one.
Oh, well, I want to wish her a very, very happy birthday.
Thank you. 2 weeks.
I can't wait. Share some pictures of her with us. We'd love to see her.
Absolutely, I will.
Celebrating her birthday. And we have a winner. As I said in the beginning, we're going to give away today our diaper bag. And we're also giving away our milk storage bags so you can store your milk. And the lucky winner today is Kayla Rain Fullenwider. Kayla Rain Fullenwider. You are our winner. Send us a private message on Facebook and we're going to ship you over your prize. You're the winner. Congratulations. Thank you again, Lauren.
Thank you, guys.
Blog live, so you can go back and you can read our personal interview that we had with Lauren. Have a wonderful day and keep us posted on Madeline.
I will. Thanks for having me.
All right. Bye-bye.
Bye.